Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Intelligence testing and the personality assessment. So the first is looking at intelligence testing. We have the Welshler Adult Intelligence Test or the Welshler Adult Intelligence Scale. Then comes the Malins. The Malins Intelligence Scale, and this is for the Indian children. So you have the Welshler Adult Intelligence Scale, and the Malins Intelligence Scale. This is for the Indian children. That is a MISIC. Then comes the Bhatia Battery of Performance. The Bhatia Battery of Performance test, and this is for the intelligence. Now moving on to the personality. The personality assessment. First is the objective. So you have the objective test. That is, example is a Minnesota. So Minnesota multiphasic personality inventory. So it is a MMPI. So it is the Minnesota multiphasic personality inventory. Next is the projective. The projective test. The projective test is where the patients are given the ambiguous stimuli. So they are given ambiguous stimuli and they have to interpret it. So ambiguous stimuli and interpret it. In doing so, the internal thought processes and the emotional factors get projected. So these can be analyzed to deduce the aspects of the individual personality. Then comes the ROR, the Rorschach test. Rorschach test is showing 10 cards and having ink blots. So 10 cards with ink blots. This is nothing but the Rorschach test. Then is the TAT. The TAT stands for the Thematic Appearance Test. Thematic Appearance Test. So here is you show a picture. So a picture is shown and it is asked to make a story. So you make a story. This is the Thematic Apperception Test. Now what is the Sentence Completion Test? Sentence Completion Test. The sentence completion test is an incomplete sentence is given to a patient and asked to complete. So incomplete sentence is given and asked to complete. This is a sentence completion test. Then is the word association technique. So word association technique means the patient is supposed to say the first word coming to the mind and upon being given a random word. So when you give a random word, you have to come up with another word. So then comes lastly the draw a personal test. Draw a personal test. The draw a personal test is nothing but DAPT and the patient is asked to draw something. So he can draw something and then he is asked to why he has drawn it. Why drawn it. This is nothing but DAPT. To learn and grow daily like this, please do subscribe.